Have you ever had a strange moment where something just didn't feel right? Maybe your hand went numb for a few minutes. Maybe you tried to say something and the words just wouldn't come out right. Or maybe just once you got off the bus or train and had no idea why you were there. And then just like that, it passed. You felt normal again. What if I told you those small, quiet moments might have been your brain's final warning? A whisper, not a scream. A last chance to act before something much, much worse. Most people ignore it. They tell themselves, I'm tired. I didn't sleep well. It's probably nothing. But sometimes it's not nothing. It's the beginning of everything changing. This video could be the most important thing you hear all week, because what I'm about to show you is the one sign your body might give you before a stroke steals your future, and you don't want to miss it. Here's the part no one talks about. Half of all major strokes that happen after a warning sign, something called a TIA, don't wait weeks or months. They strike within just 48 hours. That's 2 days, sometimes less. Imagine being given a chance to stop a life-changing stroke and not knowing you had it. That's what happens to thousands of people every year. They miss the moment, not because they're careless, but because no one ever told them what to look for. What would you do if you had just 48 hours to change your future? Let's make sure you recognize that moment if it ever comes, for you or for someone you love. Alan was the kind of man who never made a fuss. 66 years old, a builder by trade, a grandfather of 5. He never liked doctors, never missed a day of work, and believed that if something didn't hurt, it wasn't worth worrying about. 4 days before his life changed forever, Alan was standing in his kitchen, stirring a cup of tea. Suddenly, his right hand went numb, just like that. He dropped the spoon. It clattered to the floor. His hand felt clumsy, as if it didn't belong to him. He flexed his fingers, shook his wrist. No pain, no panic. Just strange. And then it passed. 10 minutes later, everything felt fine again. So Alan shrugged it off. He figured maybe he'd slept funny. Maybe his hand had just gone to sleep. He didn't tell anyone. He didn't call his doctor. He carried on like always. But 4 days later, he collapsed at work. His speech was slurred. His right arm hung useless. He couldn't move his leg. An ambulance rushed him to the hospital, but the damage had already been done. That harmless little glitch in the kitchen, that was his only warning. A whisper from the brain, a final alert before a catastrophe. He missed it. And now Alan speaks with effort. He needs a wheelchair. His wife helps him out of bed each morning. He didn't ignore that moment out of carelessness. He ignored it because no one ever told him it mattered. Let this be the moment that tells you. Here's something that might surprise you. Many people who experience these short episodes, like Alan did, don't get help. And it's not because they're stubborn, it's because they're told not to worry. Maybe they go to the doctor and say, my arm felt numb for 10 minutes. But the doctor asks, did it go away? And when they say yes, they're told, just keep an eye on it. That's it. No scan, no test, no follow-up. Just watch and wait. It happens more often than you'd think, especially if the symptom was mild, or if the patient is a woman, middle-aged, or already dealing with other conditions like stress, diabetes, or menopause. They're told it's anxiety, or fatigue, or hormones, and they walk out of the office still at risk, still one step from disaster. It's not always the patient who misses the warning. Sometimes it's the system, and that's why it's so important to know exactly what to say, to know what these symptoms really mean, and to know that even if they disappear, they still matter. Because the truth is, it's not just stress. It's not nothing. It might be your only chance. So what exactly happened to Alan in that kitchen? It was something called a TIA, a transient ischemic attack. Some people call it a mini stroke, but let's be clear, there's nothing mini about it. A TIA happens when the blood flow, to part of your brain is briefly blocked, usually by a small clot. It cuts off oxygen. The brain starts to fail. You might lose control of your speech, your vision, your balance, or the use of an arm or leg. But then the clot clears. The blood flows again. The brain recovers, and the symptoms vanish. That's the trap. Because you feel normal again, it's easy to think it wasn't serious. Maybe it was just dehydration or low blood sugar. Maybe you stood up too fast. But that's the lie your brain wants to believe. A TIA starts like a stroke, but ends quickly. There's no lasting damage, no obvious scar. And that's exactly what makes it so dangerous. Because here's the truth backed by science. 1 in 5 people who have a TIA will go on to have a full-blown stroke within the next 90 days. And half of those strokes happen in just the first 2 days. That's why we say, when a TIA strikes, the clock starts ticking. Instead of waiting, instead of wondering, instead of hoping it doesn't come back, you act fast. Because this isn't just a warning sign. It's a final chance to change your future. If you've never heard of a TIA before today, you might be wondering, how would I even know if I had one? The most common symptoms come on suddenly, often without pain, and they can be easy to miss if you're not paying close attention. There's a simple way to remember the key signs. It's called F.A.S.T, face. One side of the face may droop. You might notice a lopsided smile or trouble moving your mouth. A, arms. You could feel sudden weakness or numbness in one arm or one leg, especially on just one side. S, speech. You might slur your words, struggle to find the right word, or speak nonsense without realizing. T, time to act. Call emergency services, even if the symptoms go away. But here's what many people don't realize. TIA symptoms don't always look like the classic stroke signs. Sometimes they're more subtle. A sudden loss of vision in one eye, like a curtain falling or things going gray. Trouble walking, feeling off balance, dizzy, or like the room is tilting. Confusion. You're in a familiar place but feel lost. Or you can't follow a simple sentence. A strange sensation, like tingling or heaviness in one limb. Or just deep, unexplained fatigue. A limb that feels off. A brain fog you can't quite shake. The key is not the severity, it's the suddenness. The fact that it came out of nowhere and then disappeared. That's not just a bad day. That's your brain sending up a flare. Let me tell you about Fiona. She was 59, a retired teacher, sharp-minded and warm-hearted. One morning, while enjoying her usual routine, she sat down with a book. But something strange happened. The words on the page made no sense. It was like looking at a foreign language. Letters jumbled, meaning gone. She blinked, tried again. Still gibberish. She felt a wave of unease. But within 5 minutes it passed. The words came back into focus. She could read again. And so she told herself it was nothing. Maybe her eyes were tired. Maybe it was stress. She didn't want to cause a fuss. She didn't want to waste anyone's time. 3 days later, Fiona had a stroke. It hit the language center of her brain. She survived. But to this day, she struggles to find the right words in conversation. She pauses mid-sentence, forgets simple phrases, and gets frustrated when her brain won't cooperate. That unreadable page, that was her TIA. And if she had gone to the hospital right then, doctors might have found the narrowing in her carotid artery. They could have started blood thinners, scheduled surgery, prevented the stroke entirely, but instead she waited. So if something suddenly doesn't make sense, if your brain falters for even a moment, don't wait. Because your body's talking, and sometimes it only says it once. Now, I know what some of you might be thinking. What's the point of recognizing the symptoms if no one's going to take me seriously? It's a fair question because many people, especially women, especially older adults, have gone to their doctor with a strange one-time episode and been brushed off, told it was nothing, told to wait, told to come back if it happens again. And some of you have shared heartbreaking stories. A woman who said her doctor only works 2 days a week and never seems to be available when she needs him. A man who feared going to the hospital because of the cost. Is my life worth more than our home? He asked. That's not a question anyone should ever have to ask. Others said they were told their symptoms were due to stress, or menopause, or anxiety. One woman even said she doubted a doctor would take her seriously unless she collapsed right in front of him. That kind of dismissal is dangerous. It makes people stay silent. It makes them delay help. And that delay can be the difference between recovery and lifelong disability. So let me be clear. You have the right to speak up, to ask questions, to insist on answers. If you've had a sudden episode, no matter how brief, ask your doctor for imaging, a CT scan, an MRI, a carotid ultrasound, an ECG, blood work. You're not overreacting. You're protecting your brain, and you're doing exactly what anyone who values their future should do. So, what actually happens if you go in after a TIA? What do doctors do? First, they listen to your story, not just the symptoms, but how fast they came on, how long they lasted, and what you felt in your body. Then they run tests. A CT or MRI scan looks for damage or warning signs in the brain. An ultrasound checks the carotid arteries in your neck, the ones that carry blood straight to your brain. An ECG, or even a 24-hour heart monitor, checks for abnormal rhythms, especially atrial fibrillation, a hidden cause of stroke in many older adults. They'll also take blood tests to check your cholesterol, your blood sugar, your clotting ability. Because a TIA is more than just a one-time scare. It's a red flag waving from deep inside your body, and we have tools to respond if we act in time. In many cases, we start with medications, aspirin or clopidogrel to prevent future clots, statins to lower cholesterol and stabilize artery walls, blood pressure medications to protect delicate vessels in the brain, anticoagulants if atrial fibrillation is detected. In more serious cases, we may recommend surgery or stenting to clear a dangerously narrowed artery before it closes off completely. But none of that can happen if you don't show up. If you think, well, I feel fine now, and go on with your day. The TIA is not the end. It's the beginning of a chance to stop something far worse, and it's a chance worth taking. Here's something powerful most people don't realize. After a TIA, you don't just need medication. You need momentum. That brief warning? It's your second chance. A chance to make changes that could cut your stroke risk in half or more. So what should you do? First, quit smoking. Cigarettes damage blood vessels, increase clotting, and harden arteries. But the good news, the benefits of quitting start within days, even if you've smoked for decades. Second, lower your blood pressure. High blood pressure is the #1 cause of stroke. If you don't know your numbers, get a home monitor. Aim for under 130/80, unless your doctor advises differently. Third, move your body. You don't need a gym. Just 30 minutes of brisk walking, 5 days a week, can reduce your stroke risk by over 25%. It also lifts your mood, improves sleep, and strengthens your heart. Fourth, sleep well. If you snore loudly, gasp at night, or wake up feeling exhausted, talk to your doctor about sleep apnea. Left untreated, it increases your risk of stroke dramatically. Fifth, cut back alcohol. Heavy drinking can cause irregular heart rhythms and high blood pressure. Stick to low-risk levels, or cut it out entirely if advised. Sixth, lose excess weight, especially around your belly. Even losing just 5 to 10% of your body weight can reduce inflammation, improve insulin sensitivity, and lower your overall stroke risk. These aren't extreme changes. They're intentional ones. Because instead of waiting for another warning, you can act now and reclaim control. And when you do, you're not just preventing stroke. You're choosing the kind of future you want to wake up in. Your arteries are made, quite literally, out of what you eat. If you want them soft, flexible, and flowing freely, the fuel you give your body matters. That's where the Mediterranean diet comes in. Decades of research, including a massive clinical trial in Spain called Pre-Med, have shown that this way of eating can reduce the risk of stroke, heart attack, and cardiovascular death by up to 30%. A more recent meta-analysis in 2025 found that people who closely follow this diet have 12% lower stroke risk overall. So what does it look like? It's not a fad or a trend. It's a return to whole foods. Fill your plate with leafy greens like spinach and kale, colorful vegetables, tomatoes, peppers, broccoli, fruits like berries, apples, citrus whole grains, oats, quinoa, brown rice, legumes like lentils and beans, nuts, seeds, and healthy fats from olive oil and avocado, oily fish, sardines, salmon, mackerel. Use herbs and spices instead of salt. Drink water. Enjoy meals slowly. And what should you avoid? Processed meats, bacon, ham, sausage, sugary drinks and desserts, deep-fried snacks and fast food, packaged meals loaded with sodium and trans fats. Now here's the key. It's not about being perfect. It's about moving in the right direction. If you swap butter for olive oil just a few times a week, that counts. If you replace one meat-based meal with lentils, that helps. If you add one more serving of vegetables each day, that's progress. This isn't a crash diet. It's a lifelong investment in your brain, your heart, and your future, and it starts with your next bite. Let's go back to Alan. He didn't smoke. He didn't drink. He thought skipping dessert on Sundays was healthy eating, but he hadn't seen a doctor in years. His blood pressure was high. His cholesterol was borderline, and his hand going numb for 10 minutes. That was the moment his brain begged for help, but he didn't act because no one ever told him what that moment meant. Today, Alan lives in a wheelchair. His speech is slow and slurred. He depends on his wife for everyday things: getting dressed, getting out of bed, getting through the day, and none of it had to happen. That's the part that breaks your heart. His stroke didn't come out of nowhere. It came with a warning, a glitch in the system, a chance to change course. He just didn't know to take it. But you do. Now take a moment, look back. Have you ever had something strange happen, something small, something quick, that made you pause? Maybe your hand felt weak. Maybe your words got jumbled. Maybe you lost your balance for no clear reason. Maybe just once you forgot where you were going or what you were saying. And maybe you told yourself it was nothing. But was it? Your body speaks to you, quietly sometimes, softly, once. Did you listen? Because that moment, however small, might have been your warning. If this video helped you see something differently, please don't keep it to yourself. Share it with your partner, with your children, with your friends, with someone who had a weird episode and never followed up. You never know who might need this message. One share could mean one more person catches their warning sign in time. One more stroke prevented, one more life changed or saved. Because the most dangerous stroke isn't the one that strikes without warning. It's the one you saw coming and did nothing about. So speak up, ask questions, take action, and above all, listen to your body. It's the smartest thing you'll ever do for your brain.